So we're still going to touch on a few quality improvement concepts so you understand the model that we use in ImproveCareNow, but I really want to spend a fair amount of our time hearing from Tania Moon, who was I'm going to go back to her picture, Tania, the original parent working group leader in ImproveCareNow, and is now a continuing board member and all around, wonderful ImproveCareNow collaborator, who is going to take one of the things that Deb mentioned, being involved at your local care center and QI activities, and make it a little bit more real for us. Our goals for any parent and patient in ImproveCareNow are that you will have enough knowledge about quality improvement and the quality improvement model that we use in ImproveCareNow to be able to effectively partner with your care center's team, to be able to participate in national ImproveCareNow quality improvement activities, so things that may be above and beyond what's going on at your care center, and I would argue, most importantly, to be able to design and launch your own QI projects. So when we do kind of a more extensive training around QI for parents and patients, which we'll be offering again in the future, this is what we want to accomplish. And I hope we can do that on a small scale tonight. I do want to give you just a second to type in the chat box. I would like just a quick yes or no. And again, I know a lot of you, but there are some new names and faces. You can just type yes or no very quickly to this question. Do you have experience with quality improvement? And that can be in ImproveCareNow at your care center. It can be in your own profession. It can be in, improving how your kids get out the door in the morning. But I'm curious to see what folks say. So I'm seeing a bunch of yeses, including from some of the names I don't recognize as well. So that's really good to know. There's some good baseline knowledge of quality improvement here. Wonderful. So again, we're going to keep the didactic part of this very quick. I want Tania to spend just a moment kind of sharing the background of her quality improvement journey with her care center. And then again, we'll talk a little bit about the model we use, and she'll say a few more sort of specific things about how that model is applied to her work. But Tania, I'll let you just kind of set up how you got involved for us.
Okay, great, Sarah. Thank you so much. Thanks for having me on the call. My involvement started very similar to Deb's, where I was asked to join the group, and then we got the task of what do we want to do as parents? And boy, that's a big question, right? So we were given the task of coming up with 2 proposals to give to the team. And within those 2 proposals, we kind of lined it up like Sarah said. And since so many of you already have quality improvement experience, just think about a project if you were going to propose it. How would you make it look to a team going in that already has good knowledge of quality improvement, and you don't have probably, as me as a parent, didn't have as much experience. So we talked about the project, we talked about the goals, we talked about the timeline. So we really tried to give them 2 ideas that we could line up like that and kind of go from there. So it's been, for me, such a great learning experience to continue to propose topics this way. So it's not just the concept, and I always try and challenge myself to try and take it to that next level. What's the next, how can we as parents really look at this project a little bit differently, and how it could really benefit the patient, and how would the team view it? So I hope that answers your question, Sarah.
Yeah, that's really helpful, Tania. And I think, again, as Tania said, when she approached her care center with ideas for improvement, one of the things that a brand new parent partner might realize is that there's a certain language that the care centers at ImproveCareNow use around improvement. And again, for many of you, this is a refresher. You could teach this, and you hear these 3 questions in your sleep after coming to ImproveCareNow community conferences. But for those who may be newer, just a really quick intro, and the kinds of things you'll hear a care center talking about are the 3 questions you see here. The model for improvement that we use in ImproveCareNow was developed by an organization called Associates in Process Improvement in collaboration with the Institute for Healthcare Improvement, a big organization in Boston that leads a whole lot of different quality improvement efforts across the U.S. They took some of the best ideas from improvement science that had been applied to engineering and business and aviation, and they said, these are really good concepts, but we want to make them a little bit more practical and resonant in the healthcare setting. So they came up with this model, which looks a little bit fancy on paper, but really in many ways is how we all learned how to walk. It's trying things out and learning from trying. And the 3 questions that any care center sits down and asks when they get started trying to improve something related to the care of kids with IBD are these. What are we trying to accomplish? So in other words, what are we not doing right now that we'd like to be able to say we're doing? Or what do we want to improve that we're seeing a problem in our care setting? What is it that we'd like to be able to say that we can't say right now? And the answer to that is the aim for an improvement effort. A next question they'll ask is, how will we know that a change is an improvement? As most of you know, there are all kinds of changes happening every day. We try new things in our life at home, we try new things at work, but not every change actually leads to improvement. Indeed, sometimes it can send things in the wrong direction. So you need a simple way to measure whether what you're working on is actually making things better. And the last question is, what changes can we make that will result in improvement? What are the fun changes or things we're going to try that we think will lead to things being better? So for example, maybe we want to have 100% of our patient visits include a discussion with parents and patients about transition to adult care, because right now we're not doing that. So our aim is, and we'll say more about this in a minute, we have an aim around making sure that every visit has that discussion. We'll measure that by saying, what percentage of visits can we actually say that happened? And right now it's 0. Let's see what happens when we actually dig in and try this. And then the change, the different things that you can try to get there might involve, having a nurse have that discussion, having an iPad that has a kind of questionnaire about transition issues. So all kinds of fun ideas that maybe you get from other ImproveCareNow centers, maybe you get from good journal articles, or maybe you get from asking the front desk staff or a parent their ideas. And then this graphic at the bottom is what we call a PDSA cycle, which basically says, we're going to try things out in a pretty stepwise way. We're going to make a plan for how we're going to try something new. We're going to dig in and actually do it. And then we're going to sit around and study. We're going to say, did this actually make things better? Did it make them worse? And what should we do next based on that? So I'm going to go on. And actually, Tania, I know you have a couple of reflections to share about coming up with aims for your care center.
Can you hear me? I was like stuck.
Yep.
Stuck in the mute world. So yeah, and I know you guys can read the screen, but this is really kind of how I try to look at it when we have a new concept. So I actually had to propose something new today to our team. So really it made me stop and think about it. How am I going to look at this project different? How is this going to benefit the team? How is it going to benefit the patient? How can I present this idea with all of those things incorporated? So the example that I share on this screen is many of you have heard when we initiated the mentoring program. Today, we've hit kind of another little bump in the road with our mentoring program. And so I proposed a new idea today about training the new mentors. And it really, like I said, it made me go through these steps. What am I trying to accomplish? And how am I going to do this? And what changes can we make to what's already in place? Because there's some pieces of the puzzle that are working, but we just needed to make some tweaks. So I hope that helps, Sarah. Is there anything else you want me to add?
No, that's really helpful, Tania. It's always good to hear how you're applying that kind of in the real world. And just a couple of things that I want to share about aims. One of the things we talk about at ImproveCareNow and with the model for improvement in general is that we like to have what are called SMART aims. So a parent or patient working with their care center will probably hear that terminology. Some of you may certainly have heard about SMART aims in the past. You want them to be specific and measurable and achievable and time-bound. And I have some examples here. Again, in the interest of time, we're going to talk about these relatively quickly. But an important thing to know about ImproveCareNow is that when you are coming up with aims or things that you want to improve, ImproveCareNow has network level aims. So you will hear us say all the time that ImproveCareNow aims to have 83% of patients across the network in remission, or ImproveCareNow aims to have 95% of all patients across the network having satisfactory nutritional status. So there are big aims that we all work on together as a community, all 109 of our care centers. But as you interact with your local care center, you'll also learn that they have their own aims that are specific, measurable, time-bound, etc. And examples of those are, you know, I'm just going to throw out Nationwide Children's Hospital because it's Tania's center. They may not be at a point where 83% is the right target for them. Maybe they still have a ways to go. So they might say that their aim right now is that 80% of their patients will be in remission. And then as they're working on different things about their care process, they may have aims related to that. So perhaps they'll say 75% of our visits will involve pre-visit planning. So this is a really important point that I think sometimes is not clear to people, that ImproveCareNow has some really big things that it's working towards as a community, whereas our 109 care centers all have their own small projects and their own aims that they're working towards as part of that larger work. So I think that's really important to keep in mind. These are some other examples, some real examples from ImproveCareNow care centers. You know, again, things like the percentage of patients that will be in remission. 100% of our patients will have a documented visit within the last 200 days. We have a number of teams who are working to improve that. And again, something related to pre-visit planning, which comes up a lot. By September, we hope to have 50% of pre-visit plans to providers before a patient's scheduled visit. I wonder, since we have so many very active ImproveCareNow parents on the call, parents, patients, and clinicians, if anybody wants to type in the chat box a recent aim that they're aware that their ImproveCareNow center was working on. I hope we'll get at least a few in the chat box. I know some of you have them. All right, I'm not seeing any yet, so I'll go on, but I know a number of you are working with your care centers around QI projects, and what this makes me think is, you know, sometimes when somebody is invited into the QI process, maybe after it's already started, sometimes they miss those initial discussions about what actually is our aim, and it doesn't always get repeated enough as folks meet and work on a QI project. So I challenge all of you who are potentially working with your care centers to ask them, you know, what was the aim when this project started? And let's be sure to remind ourselves of this as a team every time we meet. So I am seeing some in the chat box now, one related to recruiting more parents. So Lisa said we're formulating an aim about entering data more efficiently into the registry. Excellent, thank you. So those are good examples. And a next step would be, how do we make that a smart, measurable aim? So there's actually, you know, a time by which the care center would like to accomplish that, and a percentage or a number target that they'd like to hit. So just a quick word about measurement. Again, we'll send these slides out, and there's some more background slides. But sometimes people hear the word measurement in the context of quality improvement, and they think it's going to be really complicated and involve really complicated statistics that might be hard to understand and involve a whole lot of fancy data collection. Absolutely, that is sometimes the case. But more often than not in ImproveCareNow, our measures are really pretty simple. They're really just flipping around your aim statement and understanding, you know, how far have you gone towards reaching that. So if we have a care center that has said that it wants to have 80% of patients in remission by January 1st, the measure of that simply is, okay, what percent of our patients actually are in remission? Similarly, if we have an aim that says we want 100% of pre-visit plans to get to our providers, the measure of that simply is keeping track of the percentage of patients or visits for which that actually happens. So a lot of times measurement can be pretty simple. I really like this last example. We had a care center that was tracking over time their progress towards their aim of having 100% of their quality improvement meetings attended by a parent partner. And their measure of that simply was, okay, we had 10 meetings this year. What percent of those had the parent partner there? So I think it's really important for parents and patients to understand that measurement is a really important part of quality improvement, but it also can be pretty straightforward and simple. And a lot of our teams, through some of their most successful quality improvement projects, the measurement starts out really as pencil and paper, you know, checking off the number of times something happened in clinic the way that they hoped it would. The last question I showed you in the model for improvement is the fun one. It's why we're all together in a quality improvement network sharing ideas. What changes can we make that will result in improvement? In ImproveCare Now, the kinds of changes that care centers are testing tend to fall into a couple of different areas. Things like improving the quality of data in our registry or in the percentage of patients that are in the registry so we can learn from their data. Things like, are we using pre-visit planning and population management to understand how kids are doing and targeting interventions based on that? And things like self-management support. So are we preparing kids for transition? As Tania said, are we getting our mentoring program up and running the right way? So a whole lot of different areas related to kind of comprehensive care for kids with IBD. But then they have to sit down and say, where do we get these good ideas? And I alluded to this earlier. They get them from other care centers. They come to ImproveCare Now webinars. They come to our community conferences and hear other teams present, other parents present the things that they've tried. They talk to other parents or patients on the parent working group calls or patient advisory council calls. And more, our care centers and the ImproveCare Now sort of communications team, as Mary said, are sharing new tools, ideas, and resources over social media. It's out there in the public domain for everybody to learn from. So there are all kinds of places to get ideas. And again, those ideas answer that third question in the model for improvement, which is what changes can we test that will result in improvement? I pulled just a couple of examples from some recent reports from our care centers, just to give you a little flavor of the kinds of changes they're testing. So one care center is testing, they're trying to improve getting patients back for visits. Maybe they're not being seen within 200 days and they'd like them to. So they're taking advantage of catching families while they're in the infusion suite and making that follow-up appointment right there and then, calling the appointment line while they're there so that it doesn't slip through the cracks. Others around self-management are facilitating IBD support groups, and still others are kind of big ideas. Right now they don't have an IBD clinic per se, but they're testing that. They're testing having a one-stop shop for kids with IBD so that the whole team is available. So everything from little things like clinic reminders to big things like testing an IBD-specific clinic and everything in between. So Tania, if you could just sort of summarize and give people your call to action around getting involved in this way, that would be a really nice way to sort of tie it all together.
Yeah, absolutely. So I think when we think about improvement at our center, we think about something that we do really well, or maybe somewhere that there's a gap, right? Something that's going well that maybe there's just a missing link, or maybe something that's just missing altogether, and that might be an idea for your next improvement project. Was it something that you might be missing that you wish was available? So as a parent, that's where we came up with our mentoring project, because Cinda and I both, when we proposed that idea, we wished we would have had mentors. So it was an easy way to think of something that we wish we had, that we could make available for other parents. Another idea is just ask your team, is there something that they have? They might have a wish list that we don't even know about. And my biggest piece of advice is to start small. Take one thing at a time. It will give you the opportunity to build from there, but you will really be able to take that one idea, whether it's creating a thank you card or a card to patients who are in the hospital. There's so many ideas that other parents have already done. You can implement it in your center and tweak it to your liking or your team's liking, and this opportunity will really turn into something great, and you can make it into your own. So thank you, Sarah.
Thank you, Tania. Thanks for sharing your time and your experience with us. And again, this was just a very condensed version of the fuller QI training that we're doing for parents and patients. When you receive the slide set that we're sending out to everybody, you will get all of the other slides that go into a little bit more detail about the model, provide more examples, and also share a little bit more about the PDSA cycle, the way that we test out all of those good ideas on a small scale. But those of you who are connected with an ImproveCare Now Center, my #1 challenge to you is that you go and ask your care center how they're using the model for improvement, what their current aims are, and how you can get involved, so that you can kind of bring this language to them and kind of enter the quality improvement projects as a partner using similar language and maybe being on the same playing field in that respect. So it helps sometimes to to understand the theory behind what they're doing. I will leave you with these two resources, and again, these will be in the slide set. There's a really lovely sort of animated video about the model for improvement that is on the Institute for Healthcare Improvement's website. That is this first link that you can all take a look at. And then a slightly less exciting but more thorough overview of the model for improvement also on the IHI website. So you have two different options there. And again, you'll also have this full slide set to learn from.